You don't know what's true. So it's really hard. You can look at one study and then you can find another study that completely contradicts that study. And it's really hard to know what is actually true. So I think that's probably pretty difficult. I feel like it's got to be for providers just to sort through the amount of information that's coming in and know how to take that information and even apply it to their patients, because sometimes the studies are a little black and white, but I feel like a lot of times they're confusing. Yeah. There's a lot of variables. It's hard to know what exactly is true. Something might say, okay, that, this study showed that there was an impact on whatever, blood pressure. But like how much of an impact and what were those variables? So I feel like the information coming out, it's really important to stay up on the information, but there's so much of it, it's really difficult to. So I'm sure that's where the specialties come in, because it's a lot easier to stay up on, information in one specialty than versus everything. Yeah, but there's a lot of information out there.
Yeah, that seems...
And a lot of conflicting viewpoints on what routes to take with medicine.
And I can't imagine how difficult that gets when something gets politicized too. Like you mentioned kind of like looking at medicine and natural remedies since you were growing up had kind of shifted your framework a little bit. How did that impact your professional career?
I don't feel like when I worked as a nurse for those like 8 or 9 years, I was really just into the medicine of it. I loved the job. I don't want to say believed everything that I was doing, but kind of. And I was working a little bit more in emergent situations. So it wasn't necessarily patients coming in with chronic health issues that we were dealing with. We were working more with acute cardiac issues. And so you're going to use a lot of those medications. You're going to do a lot of those protocols that are set in place. But now that I'm back in school and I'm working towards my nurse practitioner, we focus a lot more on the chronic issues, which is you deal with those in a completely different way. Oh, yeah. So now that I'm dealing with those, I feel like I have a completely almost different viewpoint than I did 10 years ago.